Many seniors think feeling sad, tired, or uninterested in life is just a part of aging, but it isn't. As a doctor, I'm shocked at how often depression goes unnoticed in older adults, silently affecting their brain, heart, and overall health. If you or a loved one feels down for weeks or months, these warning signs could save a life because early recognition can make all the difference. Depression in seniors is often mistaken for normal aging, but feeling sad, hopeless, or uninterested in daily life is not something you have to accept. Many older adults silently struggle, unaware that their mood changes can affect their brain, heart, and overall health. In this video, I'll share the key warning signs of depression in seniors and what you can do to protect yourself or your loved ones before it's too late. Why this matters. Depression in seniors is often misunderstood. Many people believe feeling sad or tired is just a natural part of aging, but nothing could be further from the truth. Recognizing depression in older adults is critical, not just for emotional well-being, but also for overall physical health and longevity. Statistics show that up to 20% of seniors experience clinically significant depression, yet many remain undiagnosed. Seniors often hide their feelings, thinking it is a normal part of getting older or not wanting to burden family members. This misconception is dangerous. Depression doesn't just affect mood, it can affect memory, decision-making, sleep, and even the body's ability to heal. Ignoring depression can increase the risk of serious medical conditions. Chronic stress from depression releases hormones like cortisol, which raise blood pressure, strain the heart, and increase the risk of stroke. Studies show seniors with untreated depression are more likely to develop heart disease, diabetes complications, or even cognitive decline. Simply put, mental health directly impacts physical health. Depression also affects daily functioning and independence. Seniors who are depressed often struggle with motivation, energy, and concentration. Tasks like cooking, paying bills, taking medications, or attending appointments can become overwhelming. Over time, this loss of independence increases feelings of frustration and isolation, creating a dangerous cycle that worsens both mental and physical health. Another important reason to recognize depression early is preventing social withdrawal. Seniors who feel sad or hopeless often stop engaging with family, friends, or community activities. Loneliness amplifies depression, and studies show social isolation in older adults can be as harmful as smoking or obesity. Active engagement with loved ones and the community is essential for maintaining both mental and physical health. Finally, understanding that depression is not a normal part of aging empowers seniors and caregivers to act. Early recognition allows for intervention through therapy, medication, lifestyle changes, and social support. By addressing depression promptly, seniors can maintain independence, improve cognitive function, strengthen their immune system, and reduce the risk of serious health complications. Part 2. The key message is simple but powerful. Depression in seniors matters because it directly affects quality of life, brain health, physical health, and social well-being. Recognizing the signs and taking action early can prevent a downward spiral and give seniors the support they need to thrive. Warning signs of depression in seniors. Recognizing depression in seniors isn't always easy. Unlike younger adults, older people may not openly express sadness, and symptoms often appear as subtle changes in behavior rather than dramatic mood swings. Understanding these warning signs is crucial because early detection can prevent serious consequences for both mental and physical health. One of the most common signs is persistent sadness or low mood. If a senior feels down, hopeless, or emotionally flat for weeks or months, this isn't normal. Aging, it's a warning. Many dismiss these feelings, thinking it's natural to feel tired of life after retirement or the loss of loved ones. But prolonged sadness can gradually affect motivation, memory, and even physical health. Another important symptom is loss of interest or pleasure. Seniors may stop enjoying hobbies, social gatherings, or daily routines they once loved. Activities that once brought joy now feel meaningless or exhausting. This withdrawal from life is often a red flag indicating that depression is taking hold. Changes in sleep patterns are also significant. Some seniors may struggle with insomnia, waking frequently during the night, or having difficulty falling asleep. Others may oversleep, staying in bed for hours and losing energy for daily activities. Both patterns can worsen fatigue and increase vulnerability to physical illness. Appetite changes are common too. Depression may cause a senior to eat much less, leading to weight loss and malnutrition, or to overeat as a form of emotional comfort. Both extremes disrupt the body's balance and can exacerbate other health problems, including heart disease and diabetes. Cognitive changes are another critical warning sign. Difficulty concentrating, forgetfulness, and confusion can appear alongside depressive symptoms. Seniors may struggle with decision-making, feel mentally foggy, or repeatedly misplace items. These signs are often mistaken for normal aging, but when combined with mood changes, they indicate that professional evaluation is needed. Behavioral changes like irritability, agitation, or social withdrawal are also red flags. When active senior may stop visiting friends, avoid family gatherings, or refuse to participate in community events, these behaviors are not simply personality changes, they are often the outward manifestation of depression. Finally, physical complaints such as unexplained aches, fatigue, or gastrointestinal issues without a clear medical cause can also signal depression. Seniors frequently present with these symptoms to doctors who may treat only the physical issue, missing the underlying mental health condition. The key takeaway is this: depression in seniors rarely looks like the dramatic sadness seen in younger adults. Instead, it shows up as persistent low mood, loss of interest, sleep or appetite changes, cognitive difficulties, social withdrawal, and unexplained physical complaints. Recognizing these warning signs early is the first step toward protecting mental and physical health, improving quality of life, and preventing serious complications like stroke or heart problems. Causes and risk factors of depression in seniors. Depression in older adults isn't simply about feeling sad, usually has clear underlying causes and identifiable risk factors. Understanding these can help seniors and caregivers recognize early warning signs before the condition escalates. One of the most common contributors is chronic illness. Conditions like heart disease, diabetes, arthritis, or kidney problems can be physically exhausting and mentally draining. Managing daily medications, doctor visits, and physical limitations can create a sense of frustration or hopelessness, which may gradually develop into depression. Seniors often underestimate how much these illnesses affect mood, thinking it's normal to feel down, but in reality, it's a warning sign. Another significant factor is medication side effects. Many seniors take multiple prescriptions, daily blood pressure medicines, diabetes drugs, painkillers, or sleep aids. Certain medications can unintentionally influence brain chemistry, causing fatigue, irritability, or mood swings. When combined with physical illness, these side effects can significantly increase the risk of depression. Loneliness and social isolation also play a major role. After retirement, the loss of routine, fewer social interactions, or the passing of friends and loved ones can lead to chronic loneliness. For seniors, feeling disconnected from family, friends, or the community often triggers sadness, anxiety, and eventually clinical depression. Emotional support is essential, and without it, mental health can deteriorate quietly. Major life changes and losses are another trigger. Moving into a care facility, losing a spouse, or adjusting to reduced mobility can feel overwhelming. Seniors may internalize grief or frustration, which can turn into persistent low mood or hopelessness if left unaddressed. Lastly, biological changes in the brain with aging contribute to depression. Reduced production of neurotransmitters like serotonin or dopamine can make it harder to regulate mood, coupled with cognitive decline or memory problems. Seniors may feel frustrated or anxious about their mental abilities, further increasing risk. Other compounding factors include financial stress, poor sleep, and inadequate nutrition. Even seemingly small issues, like skipping meals or losing interest in hobbies, can amplify depressive symptoms over time. The key takeaway is that depression in seniors is almost never caused by a single factor. It is usually a combination of physical illness, medication effects, social isolation, major life changes, and age-related brain changes. Recognizing these risk factors is essential for prevention and early intervention. Seniors and caregivers who understand these causes can act quickly through social support, professional help, or lifestyle adjustments to protect mental and physical health before depression worsens. Effects of depression on physical health. When we think of depression, most people immediately picture sadness, hopelessness, or fatigue, but for seniors, the effects go far beyond mood. Depression isn't just emotional, it directly impacts physical health, and that's why recognizing it early is so critical. One of the most alarming consequences is its effect on the heart. Studies show that seniors with untreated depression have a higher risk of heart disease, heart attacks, and even stroke. Chronic stress from depression increases the production of stress hormones like cortisol and adrenaline. Over time, these hormones can elevate blood pressure, damage blood vessels, and contribute to plaque buildup in the arteries. This is why a senior who seems just sad may actually be at increased risk for serious cardiovascular problems. Depression also affects the brain itself. Chronic depressive symptoms can reduce blood flow to certain regions, impair memory, and accelerate cognitive decline. Seniors with depression are more likely to experience confusion, forgetfulness, or difficulty concentrating. These changes are not normal aging. They are warning signs that the brain's health is being compromised. Another common but often overlooked effect is on the immune system. Depression can weaken the body's natural defenses, making seniors more susceptible to infections and slowing recovery from illness. This is especially dangerous for older adults who already have weaker immune responses compared to younger adults. Sleep and appetite are also affected. Depression often leads to insomnia, restless nights, or excessive sleeping, which further weakens physical health. Changes in appetite. Loss of appetite or overeating can lead to malnutrition or weight gain, creating additional stress on the heart, liver, and kidneys. Even day-to-day energy levels suffer. Seniors with depression often feel tired, lethargic, or unmotivated, which reduces physical activity. Lack of movement can worsen joint stiffness, muscle weakness, and balance problems, factors that increase the risk of falls, fractures, and overall physical decline. The key takeaway is this: depression is not just feeling down or a normal part of aging. It has real, measurable effects on the body, making seniors more vulnerable to serious illnesses like heart attack, stroke, infections, and cognitive decline. Ignoring these symptoms isn't harmless, it's potentially dangerous. The good news: physical consequences can be reduced when depression is recognized and treated early. Addressing mental health is as important as controlling blood pressure or diabetes. Seniors and caregivers must take emotional well-being seriously because protecting the mind directly protects the body. Steps to protect mental health. Protecting mental health is just as important as maintaining physical health, especially for seniors. Depression, anxiety, and cognitive decline can be prevented or minimized when seniors take proactive steps to care for their brain and emotional well-being. One of the most effective ways to protect mental health is through social engagement. Loneliness is a major risk factor for depression in older adults. Staying connected with family, friends, or community groups can provide emotional support and reduce feelings of isolation. Even small interactions, like a daily phone call, a chat with a neighbor, or joining a senior center activity, can have a profound impact on mood and cognitive function. Physical activity is another critical factor. Exercise increases blood flow to the brain, releases endorphins, and improves sleep quality, all of which support mental health. Seniors don't need intense workouts. Simple activities like walking, stretching, yoga, or gardening can boost mood and energy levels. Regular movement also reduces the risk of chronic illnesses, which indirectly protects mental well-being. Nutrition plays a key role in mental health. A diet rich in omega-3 fatty acids, leafy greens, fruits, and whole grains supports brain function and stabilizes mood. Seniors should limit processed foods, sugary snacks, and excessive caffeine, which can exacerbate anxiety or mood swings. Staying hydrated is equally important, as dehydration can worsen fatigue, confusion, and irritability. Cognitive exercises help maintain brain health. Puzzles, reading, memory games, learning a new skill, or even engaging in hobbies that require focus can strengthen neural connections and delay cognitive decline. Keeping the brain active encourages mental resilience and helps seniors stay alert and independent. Professional support is essential for those already showing symptoms of depression or anxiety. Therapy, counseling, or support groups can provide coping strategies, emotionally, guidance, and reassurance. In some cases, doctors may recommend medication, but combining it with lifestyle changes often yields the best results. Finally, seniors should monitor their mental health regularly. Awareness of changes in mood, sleep, appetite, or interest in activities can help detect depression early. Family members and caregivers should also stay vigilant, encouraging open conversations about family members and caregivers should also stay vigilant, encouraging open conversations about feelings without judgment. The key takeaway is clear: protecting mental health in seniors requires a holistic approach: social connections, physical activity, proper nutrition, cognitive engagement, and professional support. By integrating these habits into daily life, seniors can improve mood, maintain independence, and reduce the risk of depression, anxiety, and related physical complications. Remember, mental well-being is not a luxury, it's essential for a healthy, happy, and independent life. Taking small, consistent steps today can create lasting benefits for both mind and body. Depression is not a normal part of aging, and recognizing it early can save your brain, body, and independence. By staying connected, active, and aware of your mental health, you can protect yourself and your loved ones from its hidden risks. Don't ignore the signs, seek support, talk to your doctor, and take small steps every day toward emotional well-being. If this video helped you, like, subscribe, and share your thoughts in the comments. Your awareness could change a life today.